anything you have to say, Ivory?
Yes, they're not putting steroids in me.
Well, that should. I don't know what they'll do. We'll find out when the medieval Dr. Harris comes in. I wonder if they're recording us. Is there a camera somewhere? Oh, this big smiley face right here behind us by a wizard. That's a wizard. Oh, that's pretty cool.
Here for me, young lady. Go ahead and slip your hoodie off so I can get a good listen to that breathing. When did she start coughing then?
It actually started, first time I heard it was this morning.
Yeah.
Like about maybe, no, she said just your hood.
Okay.
Maybe around 3 o'clock. It usually happens about the same time, around 3 o'clock.
Has she had any sign of a cold or runny nose, or just started coughing out of the blue?
Just starts coughing out of the blue. I mean, usually, it's if she's eating something that, could affect her food allergy, cause her to wheeze, things like that.
Yeah. Did she eat anything unusual yesterday?
Or? No, you didn't. Did you eat anything? You ate that. Well, no, everything was organic. We ate. Did have some. I don't know. Not that I know of, but she was around the dog, which she's kind of allergic to the dogs in that area where the dogs were.
Did you give her a breathing treatment this morning?
No, we don't have a breathing treatment.
Do you have any albuterol or inhaler at home?
No, we don't have the inhaler.
Have you ever heard her wheeze like this before?
Yeah, she does that all the time. Every time she's around the dogs or she eats like dairy.
So what do you usually do when she starts like this at home?
What we usually do, we give her some eucalyptus, which opens her breathing passages. I mean, not internally, but I mean with a vaporizer.
Uh-huh.
Or, like I said, this allergic reaction she has, it just passes, after a few days. Like if she eats some processed food, like I said, dairy, and that will cause her to wheeze. And after maybe a few days, it does go away.
Have you ever seen her working this hard to breathe?
Yes, this is not the first time.
This is scary to me. I mean, she's really struggling with her breathing right now.
Yeah.
I want to try doing a little inhaler of albuterol here to see if we can make it a little easier for her to breathe. If her breathing doesn't calm down with this, we may need you to go to the hospital, to the emergency room. But because she's really working too hard to breathe right now.
Okay. Now, Brudol, what actually is that?
It's a medicine. It's a bronchodilator. Let me tell them. Here's the sheet. Yeah. It's a medicine that we use in individuals that have asthma or have allergic reactions. It's a bronchodilator where those air tubes, it'll open them up a little bit, make it easier to get the air in and out. Right now, when we're hearing this kind of wheeze, it usually means that there's a little constriction there and a little extra mucus in that airway too.
Right.
And it's like trying to breathe in and out of a straw. That's why you hear this real high-pitched wheeze sound.
Right.
And so hopefully this medicine will open her up a little bit. But if
Can I see the insert that comes with the medication?
Sure you can, yeah. You can get that. It'll, in terms of side effects, what you may see here for a few minutes is that it'll temporarily make her heart beat just a little bit faster.
So it increases the heart rate?
It does increase the heart rate.
Is there anything that doesn't increase heart rate that she can inhale?
There's nothing like that.
So but as long as you can breathe, your heart beating faster. But okay,
Yeah.
but I would like to see the insert.
Yeah.
Okay.
No, we can do that. If we can't get her breathing a little more comfortable here, she is going to need to go to the hospital. Okay. So it'll take probably about 10 minutes for this treatment to, and you just breathe the steam through the mask on. It's real easy to do. And then I'm going to come back and listen to her and see how she's doing with her breathing. And we'll check her oxygen level again when we're all done with this, okay?
Now, this is the previous individual. She said the oxygen was fine. I guess I don't know how she did that with her finger. Is there something that there's reads? Is that her?
Yeah, this is.
Oh, okay.
Is
that what you
yeah,
was it something on her finger that reads
yeah,
oxygen?
it's okay.
Oh, okay.
Yeah,
You
they like to
I
see
got
it at
confused what she
95 or
said.
higher. Yeah.
I was confused by what she
Well,
said. That's why.
This should make it go even higher. Like, it
Right.
should open her up so her oxygen's even better.
Yeah.
Oh,
So
okay.
that's why she wants to do it.
Yeah, if you've got good, healthy lungs,
Mhm.
your oxygen requirements usually, or the percentage is usually right around 100%.
Right,
If
okay.
your lungs are good and
Put this over
healthy.
your nose and your mouth,
Um,
okay?
so-
It doesn't hurt or anything. It's just going to kind of steam up in your
95's
face and just sit there and breathe
Not
normally like you're
considered a
doing,
dangerous
okay?
level.
Right.
If you
but
want to take a few deep
should
breaths,
be
it's
a
going to
little
really help
better.
you open.
Okay.
your chest and help you
So
breathe
say
a
she's
little
at
bit, okay?
95 right now. You said.
Mhm, mhm.
So what
All right.
is?
Is that too high on your face?
was-
Are you sure?
Okay.
Okay, here we go.
If you're 93, you go to the hospital on oxygen.
Okay.
Just breathe in that steam, okay?
Yeah, not too hard. Just take slow, deep breaths, and I'll come back and listen here when we're all done.
That was a little tight. You could have told me I would have loosened it for you. Feel a little better at all? Breathe a little bit better? Okay.
Good,
Well,
good.
Dr. Harris is coming right back in to take another listen to her, okay?
Okay. Thank you.
You're welcome.
Okay. But yeah, that's having you sleep. So.
Is it any easier to talk?
Yes.
A little bit, huh?
Praise God.
She's still
Mhm.
pulling in right there when she's breathing.
Yeah. I feel there. What time is it?
You know there's such thing as bed bugs.
Yeah, there
I
is.
think
Have a chance to get a hold of Mom?
Yeah, we did. We're going to decline the hospital visit, but the
Oh, no.
Bruderol.
We're not doing that.
Well, we have an
Because-
option. We don't have to take her to
No,
the
this
hospital.
this is an issue of her personal safety right now.
Okay. Well, from what you said earlier, that if her breathing was better, which the other nurse said it wasn't better, then we're not going to the hospital. So we do
No,
have that
I'm
option.
the doctor.
I understand that.
Okay. You do not have an option here. This would endanger her personal safety. She
Okay.
is having enough breathing difficulty that she could stop breathing.
Okay. Well, like I said, unless they're going to drive us there, we decline to go to the hospital.
Well, I will call an ambulance to take her.
Are you paying for that or?
Sir, I've been practicing pediatrics for a very long time,
I understand.
25 plus years.
Mhm.
I am very conservative. I don't send individuals to the hospital unnecessarily. But you have a child who is having respiratory distress. She's having breathing difficulty, which could be life-threatening.
I understand.
I am not willing to take that responsibility.
Okay. Doesn't you sign a
Then-
waiver to remove you from that responsibility? Because
No, I don't think that's an option here.
Okay,
Let
then
me
unless
go
they're
talk-
going to.
Let me talk to the office manager here.
Sure, if they would like to do
And
that.
find out.
If I need to sign a waiver saying removing you from responsibility of this decision, that's fine. But, I'm not weird. If she's giving a Bruderol, which I don't really agree with, that increases her heart rate, that could push her into, cardiac arrest. Because,
She
have
may
a heart
have
attack.
cardiac arrest from not breathing.
So, yeah, from the machine, she could
So,
have a heart
let me-
attack.
let me go talk
I'm
to
sorry,
the
I was
office manager.
talking to you. From the machine, she could have a heart attack because of the increased heart rate. So either way, that could increase her heart rate. So, but go talk to the manager. That's fine. That's a decision that the parents would make. If this is
I can't let you make a decision that endangers her
I'm sorry.
well-being.
I'm an adult. I can't make that decision.
I would have to call Child Protective Services.
Okay. Whatever. Talk to your manager. Whatever you need to do.
All right?
Okay.
I'll be back.
Okay.
All right.
No,
So you want to go to the hospital?
no, I'm totally good. No, next time she comes in here, I'm telling her I'm not going to go.
Before getting evaluated. So they will take good care of you. Okay. And we got to, I think, try to get to the bottom of this too, in terms of what exactly triggers these episodes. Do we need to maybe consider having her allergy tested or seeing a pulmonary doctor?
Well, we've done that, and they determined that they just wanted to try some different drugs on her, try this out, see how that works, but doesn't help her. Try that, but we already know what caused the problem because we, like I said,
which pulmonary doctor did she see?
I don't know.
Which allergist?
I couldn't tell you.
Okay. Well, make sure you talk to Dr. Chitty about that too.
Yeah,
because
I'm sure they're looking for her, so we'll be meeting with him later. So.
Yeah.
That's fine.
Okay. So, Dr. Chitty's going to call me back if you're not up there within the next 30 minutes.
I don't need more threats. I'm going to the hospital because my wife said I was going. I'm going. I don't need you to say, well, he's going to be calling. I know that. I'm aware of that. Okay. We're going, Okay.
Okay. All right. Do you need help as far as directions to get up there?
Sure. I can put in my GPS.
Sure. We'll get it.
All right.
Okay.
All right, Miss Ivory?
Yes, I'm fine.
Well, we want you to be breathing easier, hon. We really, I know it's kind of scary when it's hard to breathe.
Mm-hmm.
So,
Well, this is probably more scary for her, this whole situation, than her breathing. So, honestly, that's probably more scary. The threats and.
Well,
Well, I'm sorry, you didn't call it threat, but you strongly
I am
suggest.
being an advocate
for the
a
children,
child
exactly.
who is sick and who needs medical attention right now.
I understand.
And that's my perspective.
Okay.
The last time
Yes,
they
honey.
tested me, they said I was allergic to milk. And so I don't understand why I'm going back to the hospital after you sent me there the first time and nothing was wrong with me.
And right now, the reason you're going to the hospital is because your oxygen level is low and you're breathing too fast. So it may be that it's not an allergy. It could be that there's a little touch of asthma causing this. I don't know for sure what's causing it. But we got to make it so that it's easier for you to breathe. Okay?
Sure.
So that's why we're going.
Okay.
All right. So we'll get you some directions. Dr. Chitty will take good care of you.
Okay.
He's a Riley trained pediatrician, and he'll take good care of you.
I appreciate it.
So, all righty. So, and I hope you feel better soon. That's what I want. I want you to feel better. Okay? All right.
Oh, okay. Yeah, I'll just punch that in the GPS, and
All right.
I'm sure I know where it is, but just to make
Okay.
sure.
Yeah, now when you get there, you do not have to go through the emergency room. If you just go into the main desk and tell them you're going to the pediatric floor,
Okay.
that's where you'll meet Dr. Chitty.
Okay.
And the nurse will be taking care of her. Okay?
I will do, and this is the address 11725 Illinois, correct?
11725
Okay.
Illinois.
I'll punch that in GPS.
116.
Okay.
And it's on the left-hand side.
That's your sweatshirt.
Okay.
All righty.
When you get there, just go in and go right on up to the pediatric floor.
Okay. Thank you.
Okay?
I would just let it go, okay? Well, it's just, it is what it is.
Doctors, I'm not doing anything with your purpose.
Okay, I must not be disrespectful, okay? Let's not be disrespectful.